Hi, this is Dr. Gordon. I am a cosmetic surgeon here in Miami. But what does that mean? That means that I did a surgical residency at first and then went back and did a fellowship in cosmetic surgery. My program was accredited by the American Academy of Cosmetic Surgery. And after that, I had to take exams, both oral and written, and then went into practice. Procedures that I do are tummy tucks, liposuction, breast augmentations, breast lifts, liposuction of the chin. Also do labioplasties and some other procedures as well.
Are you ready to enhance your curves and boost your confidence? Our BBL procedure offers natural-looking results that will make you feel more confident and beautiful in your own skin. Schedule your appointment now.
Dr. Gordon, what are some do's and don'ts that people should know before coming in to get a surgery done?
So I usually recommend for my patients to take iron pills before surgery. Other things are to do your labs, usually about 4 weeks before surgery. They're good for 30 days. The earlier the better. Lastly, keep in touch with your coordinator just to stay on top of everything and make sure that you're ready and clear for surgery.
Will my doctor truly care after the surgery is done? At Victorian Body Surgical Arts, the answer is a resounding yes. We believe in comprehensive care that extends far beyond the operating room. From your initial consultation to long-term follow-up care, our dedicated team is there to guide you. Schedule a consultation with us today and discover the difference that a caring doctor and comprehensive support can make.
Hi, this is Dr. Gordon. I am a cosmetic surgeon here in Miami. Some people have asked what the difference is between having liposuction versus a tummy tuck, or when would either procedure be recommended. So a tummy tuck is for somebody who has a lot of excess skin. Sometimes it might just be a lot of stretch marks, so the skin's been damaged, or skin that is actually falling over. Really, the best thing to do with those is tummy tuck, where we're cutting out the excess skin, reapproximating everything, and giving you a nice, smooth look. As far as liposuction goes, that is done for someone who has fat underneath the skin. What that does is helps to sculpt and contour the body. So we make the abdomen flatter, we bring the waistline in, we take care of fat in the upper and lower back as well. Just to sculpt and give a more pleasing shape. So liposuction and tummy tucks handle two completely different things, although they can be used together in order to give the best result.
This is your body. This is your body with Victorian Body Surgical Arts. Schedule your appointment today.
Stop. I want it, I got it. 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 I want it, I got it.
The future of cellulite removal is here. Introducing the new technology for a long-term reduction of cellulite dimples appearance. Want to know more? Follow us.
Hi, so the question we are addressing today is what to expect during a consultation. Especially if you come into the office with me, a consultation will entail going through your history, just seeing if there are any issues that need to be addressed. Having medical conditions does not mean that you are not a candidate for surgery. It just means that we have to take extra steps in order to make sure that you are a proper candidate, that things are controlled, and that we prepare for them as necessary. Besides that, we do a physical exam. And then you and I will talk about what it is that you are looking for as a result. what it is that you want changed, what it is that might be bothering you. And that is very important, probably one of the most important things during the consultations, in addition to making sure that we're doing it safely by going through your previous history. And after that, we talk about how it is that I can help, what procedure I think would give you the best result. If there is another option, we talk about that as well, and how the two compare. And at the end of the day, we make the decision together as far as what is best for you. And then we go from there. So come and see us, give us a call. Let's see how we can make you better.
Need an extra definition? With abdominal etching, you can achieve the definition of your dreams. Start your transformation journey with us. Book your consultation now.
So the question's been asked, what to expect after breast augmentation. So usually after breast augmentation, the implants are a little bit higher than we initially placed them, especially since the muscles are spasming. So then what we do is, one, give you a muscle relaxer that helps to relax the muscles, that makes patients a little bit more comfortable and less pain. We can also put you in a broadband where we're basically trying to bring the implants down to place. Everybody's different. Some happen a little faster than others, but that helps.
Hello, my name is Ana Garbido. I got BBL and Lipo 360. Like you can see, I love my result.
Hi, so the question is, how soon can I return to work after cosmetic surgery? The answer to that is, it depends on the surgery, it depends on the person. Something like liposuction, generally, you can go back to work as soon as you feel like you're ready. Just a few days very well may be enough. Someone else may need about a week. Really what that entails is, one, that you're taking pain medication, and usually what I tell my patients is that as long as you're not taking narcotics, you can drive and you can work. After liposuction, you just wear your compression garment underneath your clothes and you go about your daily business.
Want to know what makes a great surgeon? It's all in the details. Dr. Gordon combines surgical expertise with artistic flair, carefully marking the areas to create your perfect look. His goal is to ensure each procedure highlights your natural beauty. Watch how Dr. Gordon skillfully marks the areas for your transformation, ensuring every detail is perfect. Want to see the magic in action? Book your consultation today and let Dr. Gordon brings out the best in you.
Things to keep in mind as far as BBL recovery. First thing, of course, is staying hydrated immediately after surgery. So I often recommend my patients to drink lots of fluids. Second is to walk around and keep their socks on. Of course, the massages are crucial. It helps to get a lot of fluids out, helps people feel better after the massages. And also BBL pillow, using that as much as possible if by any chance anyone is sitting down. We have those here, so we can offer those as well right after the procedure.
Hello, my experience with Dr. Gordon has been amazing. Today's my 5th day of surgery and I feel really good. The massages are awesome too. The results that I've seen are incredible and I like my new look now. Thank you, Dr. Gordon.
Hi, so the question is, how soon can I return to work after cosmetic surgery? The answer to that is, it depends on the surgery, it depends on the person. When having a tummy tuck or a mommy makeover, I recommend my patients to stay out of work for about 7 to 10 days. And after that point, then they can decide to go back to work. Again, as long as they're not taking narcotics, they can drive and they can work. Figure that you will start getting tired a lot faster at first with having had a tummy tuck or a mommy makeover. So being able to slowly get into the swing of things is a good idea. Right? As you go back to work, or your daily life, you're just wearing a binder for those 6 weeks. Just wear that underneath your clothes and you go about and do whatever you need to do. The one restriction there is not lifting anything more than 15 pounds as you're healing. After the 6 weeks, you can pretty much lift anything that needs to be done.
Give it to me like.
Feeling at your best starts here. Unleash that inner goddess. Experience the #Hourglass transformation.
Hi guys, so the question has been asked, will I have pain after a procedure? So everybody takes pain differently. So there is pain, everybody will react to it different ways. Nonetheless, we do give pain medication after a procedure. And in fact, I will give 2 pain medications in addition to nausea medication and antibiotic. Depending on the procedure the patient's had, we may even add additional pain medication onto that, depending on whether it was tummy tuck or breast augmentation, for example. Whether breast augmentation, I would give a muscle relaxer as well because the muscles are spasming. So the pressure from that increases the pain. So the muscle relaxer often helps. So everybody's different, but we treat everybody to make sure that they're comfortable as much as possible.
So my experience has been awesome. Dr. Gordon is amazing. Truly has magical hands. I love my body. And all the nurses here are so loving, very hospitable. So I would recommend this place to everyone.
Tired of dealing with stubborn cellulite? At Victorian Body Surgical Arts, we offers the latest in cellulite removal technology, designed to smooth and tighten your skin effortlessly. Our nearly painless treatment ensure you can enjoy firmer and more youthful skin with minimal downtime. Book your free consultation and discover your smooth skin solution today.
Hi, so the question for today is, will cosmetic surgery affect my sexual function? The answer to that is, I certainly hope so, but not for the reason that you think. The reason I say I certainly hope so is that with cosmetic surgery, one of the goals is to uplift and change the way that they feel about themselves. So in that, when a person is much more comfortable with their body, they feel more attractive, then hopefully that certainly heightens up their sexual activity, their sexual desire, feeling sexier. So yes, I certainly hope that cosmetic surgery will affect sexual function in a positive way. One thing that I like to tell my patients is, after having surgery, I certainly hope they should walk around naked. And I say that half jokingly, but really what I'm saying there is that I hope that after you are done with me, that you're more comfortable with your body, with how you look, with how you feel, where you're happy to wear something tighter, wear something shorter, or not wearing anything at all. But you let us know where you land on that, and we're happy to help. This is Dr. Gordon.
From this to this.
Whoa, whoa, whoa. Say whoa.
transformation awaits. Schedule a consultation now.
The question that we're going to address at this point is, will I lose sensation to my nipples after a breast procedure? Now, the change in sensation to the nipples can happen whether it's a breast augmentation or breast lift or breast reduction. So that's always a possibility. We talk about that during the visits. When I do these procedures, I do my best to try to retain the sensation to the nipples, but again, the loss is certainly a possibility, not a sure thing, but we talk about it as a possibility. Thank God the majority of my patients have sensations to their nipples. But again, there's always a possibility that sensation can either be lessened or it can be lost altogether.
Bueno, mi nombre es Catherine. Llevo hoy exactos 6 semanas de operación con el Dr. Gordon. Me hizo un procedimiento de BBL con transfer EJ plasma.
Experience the #Hourglass transformation. Does this look familiar? Feeling self-conscious about your back rolls can be a real drag. At Victorian Body Surgical Arts, we understand your frustration. That's why we offer a variety of body sculpting procedures designed to help you bring out your hourglass figure. Reach out to us today and take the first step towards a more confident you.
Hi, this is Dr. Gordon. I am a cosmetic surgeon here in Miami. Some people have asked what the difference is between a breast lift or a breast augmentation. A breast lift involves moving the nipples from a position where they are actually pointing downward or diagonally to one where they're pointing straight forward. So it involves removing skin and moving tissues around. I typically do not cut out the nipples. It's just moving it to a higher position. A breast augmentation involves putting a material underneath the breast, either underneath the breast tissue or underneath the muscle to give more volume. Right? That material could be a silicone implant, it could be a saline implant, or it could be fat. So the augmentation gives more volume. The breast lift helps bring the nipples into a better position and also helps to contour or shape the breast a little bit better by taking out excess skin and tissues that are falling. So again, these are two different procedures which can be done together to give the best result.
Come on, feeling like a boss.
Experience the #Hourglass transformation.
Love your curves but want more definition? Watch how we can help you achieve a natural-looking BBL.
Oh baby, baby. I did it again. I played with your heart.
Hi guys, this is Dr. Gordon. I'm here with one of my patients. Just wanted to talk about her experience.
Dr. Gordon is amazing. He changed my life. I was thinking about doing tummy tuck like for many years, and I decided to do it last year. Thank God, he sent me this doctor, good hands, and he does such a great job. Now I have a lipo all over my body, BBL and everything. I look great. I love it. He's such a great doctor, surgeon. I recommend it 100%.
And we're grateful to have great patients. Thank you.
Thank you. Thank you, Mr.
Thank you. So the question that we are going to address today is, do I need to have a special diet before or after surgery? The answer all depends on the procedure that you're having. First of all, we want you to have a balanced diet, high enough in protein, because you're going to be recuperating at that point. So certainly don't want you to be in a caloric deficit, meaning that you're not eating enough where you're losing weight while you're recuperating from surgery. That is just not a good idea. Your body is under enough stress already trying to recuperate. Especially with a BBL, where we're transferring fat to the buttocks and we are needing the fat cells to take. At that point, you will have to make sure that you are, again, not in a caloric deficit state, because if you are burning fat for calories, the fat that's trying to take and survive are not going to do so. We often say that you need a diet that is sufficient in protein and also in calories, especially after a BBL. So that certainly is one consideration. Otherwise, really the answer is eat as you normally would. Just try not to starve yourself, essentially.
Hi guys, this is Dr. Gordon. So just answering some questions. This question is, what is the difference between silicone and saline? So I have two of them in my hand here. This one is silicone, this one is saline. So it really is just what the implant is filled with. Both of the shells are made of silicone, so that doesn't change. So it's actually what's inside. So the inside is silicone, which is more of a gel, and saline, which is basically just salt water. All right. Major difference is if one of them would actually rupture. This one is water, it just goes out, your body resorbs it. This one is more of a sort of a cohesive gel, where if there's actually a hole in it, you would actually see it coming out. Once you let it go, it goes back in. So it's not necessarily just spreading out all over the place. For the silicone, you do have to get an MRI every 2 years just to make sure that the shell itself is still intact. So really the major difference between silicone, there are a few smaller ones. Otherwise, they're really pretty much the same.
Experience the hashtag Hourglass Transformation. Experience the hashtag Hourglass Transformation.